The scary part for us right now is that we really don't know who is COVID-19 positive and who is not, because this illness is having such a wide range of symptoms associated with it. So part of the assumption we have right now is that pretty much every patient that presents to our emergency department likely has it, and we are proceeding in that regard. The most common things what we are seeing is low-grade fever, cough, some degree of shortness of breath, fatigue, muscle aches, those kind of things. But we're also seeing patients that are having some GI-related symptoms like vomiting and diarrhea, lightheadedness, generalized weakness. So again, it's a really wide array of symptoms associated with it. I'm not so concerned about myself getting sick because I know how to protect myself and I do my best at doing so. What concerns me more is our system getting overwhelmed and at some point having to make decisions on who gets to be put on a ventilator, who does not, who do we treat, who do we let go, so to speak, and just not being able to care for all the patients that we anticipate we might see. My biggest concern right now is we just don't have a good idea of how prevalent this illness is out there right now. Since we are not able to widely test for this, we probably have a lot of this illness out in the community that we are just not registering because we're not testing for it. So that's my biggest concern, is that there are so many people walking around who are ill and may either not have symptoms yet or just have very mild symptoms, that if they continue going on about their daily business are going to infect large numbers of people. And if you are one of those people who are unfortunate to have either a poor immune system or to have other health problems or to be older in age, then that puts you at a great deal of risk. And many of those patients that get very ill with this do not survive. I feel like most of the patients are understanding, which I'm actually kind of surprised by, because we are entering each patient room wearing full protection, not gown always, but a mask, goggles, gloves, which can be very scary and off-putting to patients. But most of them understand why we're doing it. We've had, a couple instances where visitors have gotten upset for not being able to come back to the room with their family member, which again is understandable because you want to be there to support your family member in this time of crisis. There's a lot of uncertainty among the staff because we are working a lot, again, on a presumption of infection rather than knowing for sure that they have it. So you don't always know, do I need to be fully protected seeing this patient, or can I take a little bit of leeway and not necessarily fully protect myself? There's some conflicting guidance out there from the CDC, from the state health department. They're not always agreeing with what recommendations are. So there's a lot of uncertainty about what we actually should be doing. So many times, hospitals are having to come to their own conclusions about how to interpret the guidelines and hope that you're doing the right thing.